And hello, today is the first Tuesday in June, and this is the day that we normally do our essential oil class. So, wanted to just welcome you. I don't know how many are going to join us. I don't even know. It's been such a crazy day. I don't know if Tracy put out a memo saying that we were going to have a class today, but hopefully we're going to have a class today, and I hope that you're going to join me. I am your host, Dr. Heil-Mealey, and we are inside my office at Abundant Health and Wellness. Now, Abundant Health and Wellness is located downtown Humble at Main Street and Avenue C. So today we're going to ask the question, is it ever safe to ingest essential oils? Now, we're going to talk about the French method, we're going to talk about the English method, and then we're going to talk about Dr. Polly's method. So there are a lot of good things that we want to talk about. There are a lot of multi-level marketing companies that are out there, and some of them are trained, like our own Bear Oils. That's what we sell here in the clinic, Bear Oils, and we are taught how to use them appropriately by Dr. Deborah Zeff, who I absolutely adore and who has taught me so much about essential oils. But there are a lot of other companies that I have interviewed with. I have even sold some of their oils. And when I asked them to teach me how to use the oils, all they did was teach me the marketing policy on how to sell the most oils and get the most from the downline and that kind of thing, which is not really what my motivation is. My motivation is not to build a downline, although we do sell the Bear Oils. It is a multi-level marketing. You can buy them here in the clinic, or you can take them off the website, but the teaching you're going to get, the training you're going to get, is going to be from a practitioner standpoint, not from a multi-level marketing standpoint. Now, there are a lot of people out there that don't like practitioners that use multi-level marketing products because they think that they have a vested interest in you purchasing and that kind of thing. And that's just not my motivation. These are the premier oils that Dr. Deb has found for us, and they are the oils that are clean. They are the oils that are organic. They don't just say in the marketing information that they are organic. They actually have the USDA seal of approval. They don't have a stamp on there that says organic. They actually have that you can see right there, the USDA seal. So for that reason, we can recommend these oils, and we love these oils, and the oils are very, very powerful. I had a lady come in for an appointment today, and she had been sick with bronchitis. She said there was mold in her building and this, that, and the other, and I put a little bit of pink grapefruit on her throat, and within 30 minutes she was speaking normally. The huskiness, the raspiness was gone. Why is that? Because the vibrational frequency of a really good, clean essential oil, and in this case it was the pink grapefruit, will nullify the frequency of the mold and the mildew and whatever was bothering her. Now, we found this out because in November, I was having some problems with the mold because, of course, we had Hurricane Harvey here, and I was having some trouble with the mold, and it caused me to have laryngitis. I've not had laryngitis in about 10 years, and so I put a little bit of the pink grapefruit on my, it was some fractionated coconut oil on my neck, and within about 10 minutes, my voice was back, and it was all good. So oils at the proper frequency are really, really good. Now, what I've been told by other essential oil people is that you can actually put a couple of drops of your essential oil in a capsule and you can ingest it. And I'm here to tell you from a medical standpoint, that is the worst thing that you can do. So please, if you've heard that, please don't do that. I have been told that you can put a little bit of lemon in essential oil, lemon essential oil or lime essential oil in your water, and you can do that instead of a lemon wedge or a lime wedge. You don't have to worry about the E. coli bacteria and that kind of thing. And I'm here to tell you I've done that for years, but when I was in training with Dr. Deb, she said, listen, oil and water do not mix. So what you're doing is you're having that oil sit on the top of your water. Even if you stir it, it separates, and so that oil is going to latch onto your teeth and your gums, and it's going to actually burn the enamel off of your teeth. And so please don't do that. And so you know what? I am really smart, and I surround myself with people that are even smarter than I am, and I listen to them because they've been doing this longer than I have, and I don't want to have any kind of issues. Now, the essential oils are very, very volatile. They can burn the mucous membrane. You've got mucous membrane all in your mouth, in your gums, and that kind of thing. And it can actually take layers of skin off of those tissues. So you don't want to do that. So I know you've been told to do that. I have people coming in all the time and they've been told to do that, and they do that. But what it does is it opens up the GI tract and it makes you more susceptible to leaky gut syndrome. Now, what is leaky gut syndrome? Well, let me just give you a little example. If you're a doctor and you're in the medical field, you're going to say, that's not exactly how it is, but this is the way I'm going to explain it so you can understand. Think about a snake. Think about the scales of a snake that are all going in the same direction. It forms a watertight seal on the body of the snake. You have similar kind of epithelial skin cells on the inside of your GI tract. Now, they get messed up, they get loosened, they get holes in them when you have bacteria, candida, yeast, fungus, and that kind of thing in the gut. What that means is that epithelial cell, like a snake skin, that is locked tight, does not let any food proteins out into the bloodstream. When you get leaky gut syndrome, and you get that because of bacteria, pathogens, mold, yeast, and essential oil burns through that mucosa membrane, what that does is it opens up holes in the GI tract that allows your food particles to go into the bloodstream, which sets up an inflammatory response, and it will make you have some gastric issues. You could be gluten intolerant, you could be lactose intolerant, you could just have food allergies. So for that reason, please do not ingest essential oils in a capsule. So there are some safe ways that you can ingest essential oil, and I want to talk to you about some of those in just a moment. But we're going to talk about two different methods of ingesting oils, and one is the French method. Now, the French method says that all essential oils are caustic and they must be prescribed by a medical doctor only. Okay, so that leaves out all of us that are in multi-level marketing. It leaves out all of us who are holistic practitioners. It leaves out all of us who are clinical aromatherapists. It leaves out everybody unless you are a medical doctor. Now, why is that? Because there are lethal dosages for essential oils. Now, a lot of people think that it's natural, God made it, what you don't use is going to be passed out of the body, and that's true with an herb in most cases. That's true with a natural plant-based supplement in most cases. It is not true for essential oils. Essential oils are very powerful. They've got a lot of chemical constituents in there that don't disperse rapidly, and what that can do is that can set up a lethal dosage in the body that the body is not able to disperse, and so it can be very, very deadly. People have been known to die by taking essential oils internally. So the medical doctors, so the French believe, the medical doctors know the constituents of the oils, they know the concentration of the oils, they know the method of dilution that is best, and they know the length of time to take the oils. And so all of those things are things that we don't know, you and I don't know, because why? Because we don't make the oil. And most of us have never taken an essential oil class. We may have looked at some marketing material. We may have gone to some seminars. We may have seen some kind of scholarly presentation, but we don't necessarily know what the phenol constituents are of the oil and what they do at the cellular level inside the body. So for that reason, the French method we do not employ, because guess what? We are not medical doctors. Now, the other method is the English method. Now, this is not the American method, but this is the English method. Now, the English method says that with essential oils, you want to use them for massage, or you want to use them in a diffuser. Now, if you come to our office, you're going to see that we have diffusers all over the place. If you come to my home, I have diffusers all over the place. Why? Because you get 100% of the efficacy of the oil when it is aromatic. So when you smell it up the olfactory nerve, it goes right into the front part of the brain where the limbic system is, and you get 100% of the benefit of the oil. Now, if you take an oil internally, you can become very, very nauseated. So why is that? Because like I explained before, you're going to be irritating the mucous membrane in the gut, and that's your body trying to get rid of it by giving you that nausea, so you want to throw that up. Essential oils taken internally also kill your probiotics. Now, what else kills probiotics? Coffee, alcohol, Coke, soda, all right, and stress. All of those things that we are around all the time. Now, I limit my coffee intake. I limit my soda intake drastically. But there are some things I cannot limit, or I have a hard time limiting, and that's stress that just comes from life. And so while I try to limit that, and I do a pretty good job, I'm always having to supplement with probiotics because of life. So if you're taking an essential oil internally, what that's going to do, it's going to be killing your probiotics. If you kill your probiotic, what's going to happen? You're going to have that fungal overgrowth. You're going to have that yeast overgrowth. You're going to have that SIBO, small intestinal bacteria overgrowth, right? Because you've got leaky gut syndrome. So we don't want to do that. Also, the properties of the essential oils are destroyed by stomach acid. So you've got quite a chemical conflagration in the gut when you are ingesting essential oils improperly. So we don't want to do that, okay? We don't want to do that. How is a good way of getting essential oils into the skin? Well, one good way is to put it in a bath. Now, you can take a couple of cups of Epsom salt, and you can put that Epsom salt in a container and put about 10 drops of your preferred essential oil in that Epsom salt. Let the Epsom salt break down the essential oil into smaller constituents. Put that in the bath, and you can enjoy it that way. You can also put a few drops of essential oil in some milk, and you can put the milk in the bath. So you can pretend like you're Cleopatra and that kind of thing and do that. Now you want to have your full body milk. You don't want your skim milk. You don't want your 1% or your 2%. You want full fat milk. Why is that? Because again, essential oils must be diluted with another oil or a fat. If they're not diluted, remember, oil and water do not mix. Now, when I was in naturopathic school, I was taught that you could take essential oil and you could put a couple of drops in the bath and you can swish it around and it disperses the oil. And you smell it, and you do. But if you look at the bath, you've got droplets of oil in the water. And so when you sit in the water, you've got all of your personal area, both men and women, you've got your personal area in that water and it burns through the mucous membrane. So we don't want to be doing that. It's perfectly safe. If you put it in Epsom salt, it's perfectly safe. If you put it in heavy cream or milk, you're good to go on that. And that is a good way to get it into the bath. Sorry, I've been talking all day. Now, when you are using essential oils and you spill it, as we all do, I did some today and I spilled it, you want to wipe it up as quickly as you can, and you want to make sure that you don't wipe it with your hand and then touch your hand to your eye. If that happens, do you put water in your eye? No. Why not? Because oil and water do not mix. So you want to make sure always when you're playing with your oils that you have a carrier oil nearby. I use fractionated coconut, which is here, okay? And I always have it with me when I am diluting my oils. And I put a few drops, well, I haven't done this yet because I haven't got oil in my eye. But if you get oil, essential oil in your eye, you want to put some fractionated coconut in your eye. You want to put some olive oil or grapeseed oil or almond seed oil, whatever you happen to have. So why do we prefer fractionated coconut oil? Well, fractionated coconut oil has had all of the components that could go rancid removed. So your olive oil, your grapeseed oil, your almond oil, all of those oils still have all their constituents in them. And if you make a blend and you put it on your shelf and you leave it for a little while, what's that going to do? It's going to go rancid. So what we want to do is, if we're going to make a blend that we're going to use, and I have blends, I have a lot of blends. I have the, where is it? I have the Dr. Deb blends. These are the little endocrine blends. This is just the small size. I've got the big size in my bathroom, and I do these all the time. I do I roll on all over my body, right? For all of the different endocrine glands. I've got one for the thyroid, I've got one for the spleen, I've got one for the hypothalamus, I've got one for my ovaries, I've got one for my adrenals and all that kind of stuff. They are already in a blend that have the carrier oil in them. I know we talked about ingesting. I'm going to get to ingesting in a moment. If you must ingest these oils, I'm going to give you some hints on that. You can make a peppermint tea, a hot tea. And what you want to do with that is you can put a couple of drops, you steep your tea, you put your tea in your cup after it's steeped. You can put a drop or two of the essential oil that you like and let it rest for 10 minutes. During that 10 minutes, those corrosive molecules, I know corrosive is not probably my best term, but the volatile molecules that are in there will dissipate. And you'll be able to drink that. If you are cooking with essential oils, this is the best way to have them because you can use your cinnamon as a flavoring, you can use your peppermint as a flavoring, you can use your basil and your sage as flavorings, you can use your rosemary like that. So you can put that into your batter or into your sauce because why? You've got fat, you've got egg yolk, you've got olive oil, you've got, hopefully nobody says Crisco, right? We don't do Crisco in our baking anymore, although we used to, but we're smarter now and we know that that is trans fat and that's no good for us. So what if you go to a doctor and the doctor says to take some essential oil and that's okay? So how would you want to do that? You would want to put a drop into a tablespoon, okay? 1 drop of essential oil into a tablespoon of fractionated coconut oil. All right, so you want to have it very, very dilute. Now, I want to tell you some oils that you should never ingest. These are not safe. These are the ones that can be very, very lethal. And please, nobody write to me and tell me, I did that. Don't tell me, okay? So, black pepper. Now, you would think that black pepper, we eat black pepper in our food, right? But black pepper essential oil, and we have it in our little kit here. It is great for depression. It is great for anxiety. It is great for panic. It is great for a lot of things, right? You would think that because black pepper is something that you could eat, that you could ingest black pepper oil, but no, ma'am, you can't. No, sir. I see we've got some men there. Hello, Pastor Michael. Glad we've got some people that are watching us here. Cardamom. You would think that cardamom would be okay because cardamom is a spice, but cardamom as an essential oil is never to be ingested. Clove bud. Clove bud is not to be ingested. Now, I know a lot of people, and this is an old wives' tale, which it does work. You bite on a clove and it helps with the toothache and that kind of thing. And I do know people that do clove oil in a carrier oil and they put it in their mouth for a toothache. So you need to be really, really, really careful with that. Our essential oil guru, who has 4 doctorate degrees in using essential oil as medicine, says no, do not ingest clove oil, okay? What about eucalyptus? No. What about cypress? No. Do not ingest cypress. Do not ingest eucalyptus. What about frankincense? Everybody loves frankincense because it crosses the blood-brain barrier. No, don't ingest frankincense. You don't want to do that. I know a lot of people who, they're cancer patients and they tell me that they take a drop of frankincense, they put it on the roof of their mouth, it goes right into the brain. Dr. Deb says that's not a good idea. It burns up your mouth and it destroys your mucous membrane. When you have your mucous membrane integrity breached, you have all kinds of other issues, so please don't do that. Can you use myrrh? No, you cannot ingest myrrh. Now, myrrh is really good for respiratory issues. You would think that myrrh would be good to get down in the lungs and that kind of thing, but no, it is not ingestible. Myrtle, no, not ingestible. Oregano, only if you put it in a sauce, like tomato sauce, only if you put it in a like hamburger meat or something like that has a lot of fat in it, then you can, but you want to do very, very minute amounts because oregano oil is very, very volatile and it will absolutely burn up your GI tract. Patchouli. I don't know if anybody likes patchouli. That's my essential oil of choice in my diffuser in my office. It just makes me happy. I'm not sure why it does, but it makes me happy. And so I have it in my diffuser, but we do not ingest it. Okay. Tea tree oil. A lot of people think that tea tree oil, because it's antifungal, it's antibacterial, and that kind of thing, is good for ingesting. But sadly, no. Don't ingest it. Put it on the fungus on your toenail, that's fine. Use it in the diffuser for mold and as an antibiotic and all that kind of stuff. You can put it in a carrier oil, put it on your boo-boo when you've skinned your knee or whatever, that's fine. Do not ingest it. Vetiver. Now, vetiver is a favorite oil of mine. You know why vetiver? Because vetiver, and I've said this in another post somewhere, but they did some clinical trials, and vetiver is as effective as an antidepressant, anti-panic, anti-anxiety supplement as diazepam. Now, diazepam is a prescription. It is an anti-anxiety prescription, right? And the research shows that vetiver is just as effective with anxiety as is that diazepam. And that's good because a lot of people suffer with anxiety. A lot of people have some really kind of panic moments. I mean, I think that's just kind of the world that we live in. But you do not want to ingest it. You want to smell it. You want to put it on the bottom of your feet. You want to put it in a carrier oil. If you put it on your body, you can put it in the diffuser. One thing that I like to do if you're prone to anxiety is I like to put a little drop on the inside of your shirt collar. And then that way when it rubs on your neck, you're getting the fragrance and it calms you down. Now, I haven't had to do that because I don't suffer from that kind of anxiety, but I know people that do, and they tell me that just the inhaling when they put it on their feet or they put it on their hand, just that fragrance just calms everything down. So if that's something that really bothers you, then what you want to do is you want to put it on the inside of your collar and see how that works for you. In the Bare Oils blend, we've got several different blends. We've got Boost, which is to help you with your energy. We've got Purify, which is a antibacterial that you know, when people are coming and they're snotting and sneezing and all that kind of thing. Those two we do not want to ingest. Okay, we do not want to. Now, one of the things that you need to know is cinnamon, right? Cinnamon is something that I said you could use in baking, but you do not want to use on your face. You do not want to use it on your jaw. You do not want to use it in your toothpaste. I know there are some cinnamon gums, there are some cinnamon toothpaste and that kind of thing, but they're not made with the real stuff. They're made with a synthetic, and so they're not going to have the vibratory frequency of cinnamon. But cinnamon is very, very caustic to the mucous membrane. So when you're using cinnamon, if you want to put it in your cookies, cinnamon cookies, if you want to put it on your oatmeal with butter, I'm okay with that. 1 drop or 2 drops, you're going to be fine. You do not want to put it on those mucous membranes because it's very, very volatile and we could have some problems. So I'm not seeing any questions. I'm seeing a lot of people pop up, and I do appreciate you tuning in. And we're going to post this so you'll be able to listen to it with your pen ready so you can write down those oils that you would never ingest. The other ones, as I said, you can use in your cooking just fine. You can use them on the body with a proper carrier oil. You can use them in your bath with either milk or Epsom salts, right? And you can always use them in the diffuser. Now, why is the diffuser my favorite way? Because you get 100% of the efficacy in the essential oil in a diffuser. You only get about 20 to 25% if you put it on your body. So these oils are expensive. Hey, Darla, they are expensive. You have to put them somewhere safe, so they're kind of cumbersome. And you don't want to mistreat them. So make sure that you love them. Make sure that you get to know them. Make sure that you use them appropriately, because we don't want anybody coming up with lethal dosages of essential oils. And I don't want to see you in my office because you've got leaky gut syndrome because you've been taking essential oils internally in an inappropriate way. So be sure and post any questions. We will answer that after this post. We're about at the end of our time. I think I've got about a minute and a half. So if you want to pop a question in, that would be good. We'll try to answer that. But I really, really want to dispel the myth that it is okay to put essential oils in a capsule and then ingest the capsule. That is absolutely the worst way. On the ethics, let me just put this in while I've got just a minute or two. There is the International, let me see, where do I have that? International Federation of Aromatherapists. Okay, so this is international. And what they say is if you are going to recommend people to take essential oils internally, you must have an insurance policy, a substantial insurance policy to protect you and indemnify you in case anything goes wrong. Why? Because almost certainly something will go wrong if you ingest essential oils in an inappropriate way. So this is from the International Federation of Essential Oil Aromatherapists. It's their code of ethics. So the next time somebody says it's okay for you to put put essential oil in a capsule, you want to ask them how much insurance they have because, like I said, these are very, very volatile and there are lethal dosages of many of our lovely essential oils. So I'm going to say goodbye for now. Love you guys. Thanks for spending some of your Tuesday afternoon with me. If you have any questions, just pop them in and I will get back to you with the answers as best as I can. And I will see you probably not in July because it is the day before the 4th of July and most people have that whole week off. So I probably will not be seeing you in July, but I'll see you the first week of August. Take care. Love you much. Bye-bye.